Hi, I'm Dr. Jeff Runge. I'm one of the attending surgeons here at Guardian Veterinary Specialists. I want to tell you a little bit about a case that we just did named Ginger. Ginger is approximately an 8-year-old spayed female mixed breed dog that actually had a very interesting injury that is a little bit of an unknown because she was outside and had a penetrating thoracic injury from potentially a stick that went into her thoracic cavity and somehow potentially seeded bacteria and even some foreign material, the stick, in the chest around the heart and lungs. Ginger originally was evaluated and finally made its way to Guardian, and at that point at Guardian we determined that she had something called a pyothorax. Pyothorax basically means that there's an infection in the chest cavity. My teammates asked me to get involved because once we determined that it's a pyothorax, we tried to see whether or not we just want to treat it medically or if it needs to be surgically treated. The CAT scan showed an area of at least an abscess and maybe some foreign material that was somewhere near the esophagus and potentially near one of the lungs. What my team and I did is what is called a thoracoscopic assisted explore, which means that basically we're doing a thoracic surgery using a camera as well as my eyes and hands. So it's a hybrid technique which takes the advantage of both minimally invasive surgery and open surgery. We chose this in this situations because I actually needed to use my hands in some degree to feel and move around some of the tissue. But I also wanted to use the cameras to get to very small spaces to see what's going on. We chose to do what's called a median sternotomy with scope assistance. So what I did is actually made an incision along the breastbone on Ginger and allowed me to get through into her chest. From there, from that incision, my cameras went in to try to find and identify these regions. We did identify actually a foreign object. There were several pieces of wood, and the wood actually penetrated into 2 different lung lobes as well as created an abscess. I followed this and removed these 2 lung lobes because they had to be, unfortunately, taken because they were so infected and they actually had wood within them and they were bleeding from that. The other area I took for was looking at the actual spot where the wood went into the chest. This went through the thoracic inlet, the space between the spine and the breastbone up here by the neck. We actually found wood there as well. The camera went through this into the actual chest itself and I made sure there's nothing left behind. After the lungs were removed, the chest was flushed and lavaged, which means I basically washed it with saline, taking any of the fragments and bacteria out, and then we placed 2 chest tubes in the chest also to help lavage and remove any of the remaining bacteria that are there. Ginger was recovered in ICU with broad spectrum antibiotics, pain medications, fluid therapy, and basically supportive care for the last couple of days with our ICU team, including Dr. Ateka. From there, now we're seeing the benefits of this hybrid type of surgery as well as Ginger's recovery. She's looking fantastic. She's pain-free, she's being treated for her proper antibiotics to get rid of the infection, and now she's breathing great and she's not bothered by the wood that was in her chest. She's going to go on to an excellent recovery and we expect her to probably go home about 2 days after surgery.